Hi everyone, my name is Corey Stackhouse and welcome to today's video. Now I know navigating the Medicare prescription drug plan playground can be super complex and even compared to navigating a maze. Whether it is talking about the deductible phase or the initial coverage phase or the donut hole or the catastrophic phases, that can all be very overwhelming. Whether you are new to Medicare or you are just wanting to maybe make a switch for your prescription drug plan in the year of 2024, today's video is going to be just for you because I'm going to share 3 things that you must know before you decide to enroll in Medicare prescription drug plans in the year of 2024. So let's begin. So first, let's discuss what Medicare Part D coverage is. Fun fact, a lot of people don't know that Medicare prescription drug coverage is not offered by the government. It's actually going to be offered by private insurance companies, which are approved and then subsidized by Medicare. There are also 2 ways that you can get prescription drug coverage. You're going to have a standalone prescription drug coverage plan, or you're going to have a Medicare Advantage plan that also offers prescription drug coverage. So let's break those down a little further. So a standalone PDP, it gets its name because it is going to be a prescription drug plan only. It is not going to offer any hospital coverage or Medicare coverage. You're also going to have a separate monthly premium for these types of plans in addition to your original Medicare, in addition to any supplement plans that you may have as well. Those are going to cover the hospital and the Medicare, or the medical cost, Okay, so a Medicare Advantage plan with a prescription drug coverage. It's going to combine the Medicare, for example, for comparison's sake, it's going to combine some of the coverages you may receive from original Medicare and a Medicare supplement plan together into a package product. So these are not supplement plans though, but they are going to replace your original Medicare. So if you do enroll in a Medicare Advantage prescription drug plan, you are no longer going to be covered by the traditional Medicare's Part A and B. Now, please note there are Medicare Advantage plans that do not offer prescription drug plans, and if you purchase one of those, you will not have access to prescription drug plans during that calendar year, except there is an exemption for some private fee-for-service Medicare Advantage plans, but that is a rabbit hole that we won't go down in this video today. Okay, so if this is a little bit confusing, I understand. If you would like any assistance in the area of figuring out what the right plans for you, we are happy to help. Here's a little snippet of our contact information, but let's move on through the video. Bottom line, again, Medicare Advantage prescription drug plans, make sure it is a MAPD, not a MA only plan when you are considering a Medicare Advantage plan with a prescription drug plan included versus just a standalone prescription drug plan. So now on to the 3 biggest things that you needed to know and I wanted to share with you briefly today. So utilization management. This is one of the 3, this is one way that insurance carriers have the opportunity to prevent overuse and to keep their costs down inside of the plan. First thing they can do, they can require prior authorization. So your doctor or yourself, you would need approval from the insurance plan on the prescription drugs the doctor has subscribed to you prior to getting payment from the plan. They just want to more or less make sure that you are using the best alternative available to them for keeping their costs down. There are sometimes quantity limits. In most use cases for this, if you've got painkillers, those are some drugs that that insurance companies like to keep a restriction on because of the event of overdoses being unfortunately a real risk that we have at hand. Now, the last way that insurance companies can help with utilization management is they can have step therapy. In short, they can request that you use an alternative drug prior to authorizing again what the doctor ordered for you in order to hopefully keep costs down by using a generic versus a name brand, for example. Now, although there may be some exceptions to these rules, please make sure you do your research on your medications and look into the formularies to see if there's going to be any utilization management that is going to be applicable to you before you decide to sign up for a plan. It could really just save you thousands of dollars in the big scheme of things if you make sure that you're doing your research on the right product for you. Unfortunately, if you pick the wrong plan for the upcoming calendar year, you're kind of stuck with it until the upcoming calendar year. So at the timing of the recording of this video, we've got open enrollment around the corner for the plan year of 2024. You'll be stuck with that plan for the entire 2024 calendar year, and then 2025, you'd have the opportunity to re-enroll in a different plan that would be better for you. Second big thing is going to be understanding the phases of Medicare Part D. So I alluded to that at the beginning of this video, but there is a deductible phase for all prescription drug plans. That is going to be a $545 annual deductible. So you must pay this before your drug plan is going to start covering the cost of the drugs that are offered inside of that plan. Now, most plans will waive the deductible for tier 1 and tier 2 drugs. Now, there is a tier system within most insurance companies that the higher tiers are going to have higher out-of-pocket costs to you as the consumer. Now, if you are taking most of those drugs that are going to be in the higher tier, you'll probably blow through that deductible very, very quickly. Now, the drug formulary, this is what each individual plan will have a list of accepted and not accepted drugs inside of them as well that you want to take into consideration. The second phase is what we're all familiar with, the initial coverage level. This is whenever your coverage is going to start kicking in. So you will either pay a portion, during this period, you will pay a portion of your prescription drug cost. It'll either be a fixed payment of either $3 or $5 or $10 or $15, whatever it may be, depending on the plan that you're in, or you will pay a co-insurance for a maximum cost of 25% of the full retail cost of that drug. That was a mouthful. During this period, your costs tend to be the lowest on your prescription drugs, that second phase. The third phase, which I didn't organize on my slideshow here, is going to be the coverage gap. That's coverage gap. That is the donut hole that we've all heard of before. If your full retail prescription drug costs exceed more than $5,030 in this phase, you can expect that your out-of-pocket costs are going to increase significantly during this period until you hit the catastrophic level. So jumping to the catastrophic level, the last phase, that's whenever your total costs throughout the year are going to reach $8,000 out of pocket for yourself. There are some more fine details inside of this, but that is a 10,000 foot view of how these different phases of Medicare Part D are going to work. Okay, so how do you determine which plan is the best? So there are a lot of options. You've got WellCare, Humana, Aetna, SilverScript, United Healthcare, and other cares. I believe there's over 20 nowadays. Now, you have lots of different options. I represent most of these options. I cannot say I represent all of the options, but the short answer of which plan is best is there is no best individual option for the general population. The two main things that I like to note in this section are going to be, don't always think that the highest or most expensive plan is going to be the best. You may have some cases where the out-of-pocket costs for generic drugs on a super expensive plan are going to be higher than what they would be if you were on for example, a $8 a month plan. Now, the biggest factor I believe in determining the best plan for you is determining what's your out-of-pocket expense expected to be throughout the calendar year. That's going to be taking into consideration the monthly premiums you're going to be paying for the plan itself, the deductible held inside the plan, and the copays that you're going to have for the current drugs that you're on. And I emphasize current because unfortunately we cannot plan for the future, or we cannot future-proof your drug plan per se. So you want to focus on what your current needs are and maybe some other prescriptions that you might want to consider jumping onto when you're doing your research on this. So how to compare your options. You have multiple places you can go. You can go to Medicare.gov. They've got all of your options online, which you are more than welcome to do a lot of research on deciding what plan is going to be best for you. You can call Medicare directly. Although the consumer that you speak with is not going to have direct experience in working with the insurance companies and the Medicare plans themselves that you are considering shopping for, you could also consider looking at an insurance broker like myself or anybody else that you know out there that you trust. They're going to have access to a lot of comparison tools that on site, if you were able to provide them your primary care physician and your prescription drugs and your preferred pharmacy, we're going to be able to spit out the numbers that what's going to be the most cost-effective plan for you in most cases. Now, if you decide to contact an insurance broker or call Medicare, there is not going to be any cost for you doing it or any obligation for you to work with that representative that you speak with either. So please take that into consideration whenever you're considering doing some shopping for your Part D prescription drug plans. So I hope today's video was helpful. Those are the three things that you need to be considering whenever you're considering your prescription drug plan. You're going to want to pay attention to utilization management. So what prescription drugs is the drug formulary going to have for you? And then is there going to be any utilization management that's going to be incurred upon you? Understanding the different phases of Medicare, so understanding the deductibles and the coverage levels and what your out-of-pocket expected costs are going to be through each of these phases is going to be very useful to understand as well. And then lastly, in determining what best plan for you, my suggestion, but please contact your trusted insurance broker or contact Medicare directly to decide what's going to be best for you. It makes the most sense to look at what is going to be the most cost effective for you, based on the variables of your current prescription drugs that you have and the out-of-pocket expenses tied to them, the monthly premiums, and the deductibles that are all associated with them. So again, I hope that was helpful. In the event you found value from this video, please consider sharing it and liking it. It does help the YouTube algorithm share this video with other people out there who may benefit. Also, if you know a friend or family member who may benefit from this as well, please feel free to share my information with them in addition to that. Otherwise, if you'd like to get in touch with our office, our contact information is in the description below. Please check that out. Otherwise, have a great day. Thank you for your time.